As the province continues to ease COVID-19 restrictions, the PPE Task Force has been reviewing the AHS guidance that remains in place and discussing how best to keep our staff, patients, and families safe in this next phase of our pandemic journey. While masking is no longer mandatory in most places in the community, AHS requires continuous masking in all AHS facilities, including acute care, continuing care, and community sites, as well as in corporate and warehouse type settings. Today, I will be talking about masking in corporate offices and administrative areas, as well as changes to eye protection. Over the course of the pandemic, staff-to-staff transmission has occurred in corporate and administrative areas in our facilities. When we review data on AHS staff infections, we see that one of the greatest risks to our staff is exposure to other staff who may be incubating COVID-19 or have mild or unrecognized symptoms. Although COVID-19 numbers are slowly decreasing, we know that we still have ongoing transmission in the community, and we feel this risk warrants a policy that maintains continuous masking in place at all facilities, including corporate offices and administrative areas. Wearing masks in corporate settings is another layer of protection in addition to vaccination that ensures our staff remain healthy and safe while at work as COVID-19 continues to circulate in the community. So where do you need to wear your mask when you're in these settings? In the office and corporate settings, masking is required when you cannot keep 2 meters apart from coworkers. This includes common areas such as kitchens, staff or meeting rooms, in hallways, or when entering a patient care space if your corporate setting is attached to a hospital or other patient care area. Masking can be removed when you're not anticipating to be within 2 meters of others. So that includes when you're working in a private office space or at your desk when you're 2 meters apart from others. In the months to come, our focus will continue to be on protecting the health and safety of patients, families, staff, and physicians who are essential to keeping our healthcare system available for all Albertans. We will continue to review our masking guidelines and make changes based on COVID-19 transmission, infection, and hospitalization rates as the threat of COVID-19 evolves. So let's talk about eye protection and the changes that we are recommending. While AHS will continue to keep the continuous masking directive in place for now, the PPE Task Force has made the decision to provide more flexibility around eye protection. Continuous eye protection must be maintained in AHS settings where frequent or unanticipated exposures to COVID-19 may occur. This includes screening areas, anyone working in EMS, in our emergency departments or urgent care, as well as those providing care in assessment centers, COVID-19 units, and outbreak units. Eye protection should also continue to be utilized as part of respiratory precautions, either modified respiratory precautions or contact and droplet precautions, or as directed by your point of care risk assessment prior to seeing a patient. Continuous eye protection is now optional in all other areas and situations in AHS facilities. We encourage anyone with questions to review the eye protection guidelines that can be found on the Insight website. As we continue to monitor COVID-19 and the impact on our staff, we want to remind everyone that break rooms, charting areas, and other common spaces continue to present a risk for transmission of the virus. We ask that our staff remain vigilant both within patient care settings, but also while on breaks and during shift changes. It's also important to continue to self-monitor during shifts and ensure that you do not come to work if you feel unwell. If you do have any questions regarding any of our current guidelines, please visit our FAQ PPE Task Force on Insight.
Together, we do amazing things every day.